Hello, everybody. Happy AEP. I know you don't really know what that means. It's annual enrollment period for Medicare. I'm making this video and I will make it as short as I can as a way to tell you about some of the rules that are changing, save us some time on some appointments, and at least keep you educated, maybe even give you something you can forward on to your friends to kind of let you know what's going on with some of the rules and how these things are going. Now, AEP annual enrollment period does not start until October 15th. October 15th until December 7th. Right? I have between those days to meet everyone that needs or wants to meet with me. I'm allowed to start talking about the plans and the plan changes October 1st. So roughly 4 weeks from now. Obviously, I do this for a couple of thousand people. So I'm sending this out to you, and I will be sending you a link to make an appointment to schedule it ahead, and I'll make another video about doing that, right? But this is just going to be, hopefully, I'm going to try and make it to a 15 to 17-minute video, just kind of explaining Medicare, what's going on, going over things that you should have heard as my client previously, and telling you about the biggest news of the year, all right, with prescriptions. All of this stuff is legal. I can talk to you about this now. I can't discuss plans until a little bit later, right? So here we go, without further ado. And I am going to try and draw on my screen with a red pen using a mouse. So sorry about my handwriting. All right, first and simple. Part A. Part A is what you should have gotten on the first of the month in which you turn 65. It is $0. It is for hospital and hospice, right? Second part, this is the ugliest part. Part B. Part B costs $174.70. This is subtracted from your Social Security if you are taking Social Security. If you are not taking Social Security, if not, then they're going to bill you monthly or quarterly, excuse me, quarterly. That should say quarterly. I apologize. Quarterly, $524.10. A couple of things you need to know. First, some of you are not seeing this $524.10 because you are getting a reduction from your Part C. We'll get into that in a minute. Now, other things you need to know for next year. If you are making more than $100,000 a year, you have to pay IRMA. If you're not, you're paying the 174 monthly or the 524 quarterly. If you're making less than $1,734 per month, right? You can get the 174 given back to you, but you have to let me know that you're making that. And it's not per person. Well, it is per person, but if you're a household, the number changes a little bit, and we can talk about that in our appointment. Right? So part A, part B. Now, here's where we get into it. There are three different categories and rules about how it is you get Medicare. Okay. Category number one, the reason why it's blank, right, is I don't sell group Medicare. These are for people who worked at Kodak or Xerox or IBM or the U of R or the town of Ogden or whoever the case may be. And when they retired, Medicare was part of their retirement package. The reason I bring that's none of you because I don't sell it, so I wouldn't be your client. I do help people do this just because no one ever helps out anybody at the U of R. But the reason I bring it up is if you were to talk to one of your friends and they say, "Hey, listen, that's not the deal that I got," ask them where they worked. Okay. Number two, Medicare Advantage. Right? These are all the commercials that you see on television with like Joe Namath and all of those guys. Right? They're trying to get you. Medicare Advantage plans are carrier designed Medicare plans. What that means is the carriers, Blue Cross Blue Shield, Univera, Aetna, United, MVP, CDPHP, all of them I represent all across New York State and like 8 other states. They are allowed to design the plans whichever way they want as long as they meet the federal minimum standard. So they all have to do at least the same thing, and then go over and above that to try and seduce you into being their clients. How about silver sneakers? Would you like free dental? How about a hearing aid? Like they'll do whatever they can do to say, please, 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 please come be our clients. Okay. At our agency, at His Foundation Inc., that's my company, right? We run it through three things. Thing number one is called plan summary, meaning what does it actually cover? Some plans have dental enrolled in them. Some plans don't. Some cover chiropractic. Some don't. Some cover acupuncture. Some don't. Some have free silver sneakers. Some don't. So on and so forth. Next is the plan network. Does my doctor take it? Right? This is where we get into those fun letters. We get into the HMOs versus the PPOs versus the HMO POS and so on and so forth. Right? We can talk about that at a different appointment. Just know that those all have to do with doctors. Now, there is one thing I will say. Every single plan must have worldwide emergency room coverage. So if you're not a snowbird, if you're not living 6 months in one state, 6 months in the other, you're just living in the greater Rochester area, right? And you just want to go to doctors here, right? Then you are fine. Unless you're like, hey, listen, I've come down with cancer and I want to go down to MD Anderson in Texas because they've got the best cancer clinic. Then you would have to switch and get a different plan. If you're living in Florida and you want to visit your doctor up here and your doctor down there, then you need a different one. But again, we can talk about that at our appointments. I'm just kind of letting you know how this works. Plan costs, right? This is where this is the most important part, right? If you get a plan and the plan says, do you cover up here? Do you cover MRIs? They say, absolutely. You need to ask them by how much. Some cover it at $175 for an MRI. Some are $500 for an MRI. What does it cost? They can say, yeah, it's covered, but how much out of your pocket are we talking? So we run it through those three things. Okay. Now, Medicare Advantage. What is the Advantage? So it is Part A, Part B, Part C, Part D, all wrapped together into one card, one plan. And a lot of them have vision, dental, and hearing in the plan. So you got A, B, C, D, vision, dental, and hearing all rolled together in one. That's your Advantage. You don't have to think about it. You just drop it like it's a gold card. Take care of what you need to. Option number two. Now, I did this math for you. So if you were to look at $0 for A, $174.70 for B, C has negative $90, negative 74, negative 45, negative 31, 0, and then up from there, right? These are Part B reduction portions. So they actually reduce the portion of Part B. They cannot pay it to you, so they give it to the government. The government reduces this 174. So if we took 0 plus 174 minus 90 plus 0, you come up with $84.70, right? Best case scenario in Rochester. Worst case scenario, right? Well, not worst case scenario, another scenario, let's put it that way. 0 plus 174 plus 0, right? Plus 0, you're looking at 174. So we have a range of 84.70 to 174. Yes, there are plans that charge you, like the Blue Cross Shield Access Plan for last year was charging $14.40. Okay, so yes, it goes up from there, and we'd have to add that in. I'm just giving you a general scenario. Okay, so you're looking at $84 to $174 per month. All right. Group Medicare is done. Medicare Advantage is done. Now we move on to Medicare Supplemental or Medigap plans, depending whichever term you're used to. These plans are government designed. And while that might not entail a lot of confidence, the government, what it means is that the government designed the plans. So down over here, when we're saying, hey, listen, do you have to does it have vision? Does it have dental? Does it have hearing? What about silver sneakers, gym memberships? What about, no, it doesn't matter. They're all the same. So if you went to Aetna, you said, show me your plan G, G for government. There is a K and an N, but G. So if you said, show me your plan G, and then you went to Humana and said, let me show me your plan G, and then you went to Excellus and said, show me your plan G, it's the exact same plan. There's no plan difference at all. The government told them what they had to do. Okay. So what that does is it takes plan summary off the table because they're all the same plan. It also takes plan network off the table, right? Because over here, if the doctor has a license and he's accepting Medicare, right? Every doctor in the United States that accepts Medicare is in network. So going down to Texas, no big deal. But there's a little bit of thinking involved. Here, there's part A and part B. You get one card for that. Then you get another card for part C. Then you get another card for part D. So you actually get 3 cards. You got to remember what goes with what. So if we do math, 0 plus 174 plus 286 plus 4, I just rounded up, right, is $464. Yes, it can go up from there. That's why I put the and up. $464 a month. This is not my recommendation, right? But I want you to know that it exists, and I will explain why I want you to know that it exists, right? Because there are some good scenarios for this. But anybody with a calculator, right? So $464 minus a worst case scenario of $174, you're overspending. That was a bad circle. I'm sorry. You're overspending. Can I do it again? $290. I'm going to round and call that $300. $300 times 12 months is $3,600. This plan would cost you $3,600 more than this plan. And that is the least expensive in 2023. I don't know the prices of 2024 yet. Okay? So why in the world would someone consider this? Again, it's not my suggestion. I'm just explaining. That's where this comes in. On Medicare Advantage plans, you will have copays. This is not a plan. I'm not allowed to talk about plan specifics, right, on this particular video, right? These are just generic numbers that I picked up, right? So if you went and got a primary care, you're looking at $0 to $15 to go see your primary care physician. If you went to go see a specialist, $35 to $55. Now, again, there are other plans where this is 0 and this is 35. It's just an illustration. If you go inpatient into the hospital, you're looking at $475 a day for the first 5 days. Then from day 6 to day 90, just kind of kick back and enjoy the jello. It is paid for, right? If you go to the emergency room, you're looking at $100. MRI, $300. Again, not a plan, just illustration numbers. Physical therapy, $40. Right? And then you can go on from there. There's other things, skilled nursing facilities, so on and so forth. Now, let's just say you had to get a knee replacement or a hip replacement. So you could possibly go to your doctor who's going to refer you to your specialist, who's going to charge you $55 to go get your $300 MRI, then charge you another $55 to read you that MRI. Then you're going to go in to get surgery. Your surgery is going to be right around $400. I didn't put surgery down here, but it'd be about $400, right? Then possibly a stay in the hospital, right? And then 10 physical therapy visits. So you're looking at that knee surgery, right, of $1,200. Told you I can't draw with a mouse, right? And up, right? All the way up to $1,700, $2,000, whatever the cost, how many days you stay in the hospital. So you're looking at a big cost here. If you go on a Medicare supplemental policy that you overpaid by $3,600, your primary is 0, specialist costs you 0, inpatient costs you 0, your emergency room nothing, MRI is nothing, physical therapy is nothing, surgery is nothing. You don't pay a dime for any of this stuff, except you must pay the deductible of $240 once a year. You drop the $240, everything else is on the house. Right? Now, this is another thing I'm about to show you in the state of New York. I can take you from this plan and put you on this plan anytime we want, as long as it's the first of the month. Okay? I tell people this, I tell them jokingly, you cannot be in the ambulance on the way to the hospital, calling me up, going, switch it now. It doesn't work like that. Right? It can only happen on the first of the month. You cannot come back until January. So once you're over for the rest of the year, right? And again, this is only New York because we don't have underwriting. Other states, you would actually have to take a physical to make that happen, right? So from here to here, not here to here. So if your copays start equaling up to $3,600, this could possibly be a better bet. Again, no vision, no hearing, and definitely no dental. It is strictly medical. Okay. So now you're getting an idea. This is again Medicare 101. I haven't talked about any specific plans, right? Yeah, I guess up here, if you want to say I'm talking about specific costs, you could say that. Maybe I'll get in trouble for that. I don't know. Here we're going on. Prescriptions. This is the biggest news of the year. All right. Already 2024. You have 5-tier drug plans. Generic, preferred generic, name brand, experimental. Oh, excuse me, preferred name brand, and then experimental, not like the high school kind, right? So these 5 tiers, the way that it usually works, deductible is you are paying 100, please, 100% of the cost of these 3 tiers. These 2 do not count towards your deductible. These ones do. So these count towards the deductible. These do not. Right? So you are paying the first 100% of any drug that is in these 3 tiers until you get to whatever your deductible is. $250, $400, $500, $580, whatever plan you choose, it has a deductible. You are paying 100% of the cost of your drug, right, for these 3. This is why I get calls every January after we pick in a plan. And they call me up and they say, hey, listen, in November and December, I spent $40, $42 for my Ozempic, my Trulicity, right? And now it's January and they just charged me $400. What plan did you put me on? That's because you still have to pay your deductible. Once you get past the deductible, it goes to copays again. Okay? And then once you get past your deductible, we get into the coverage phase. The coverage pays is where you pay copays. $5, $12, $40, $50, whatever plan you choose in those copays. Again, we're not talking plan specific right now. Right? You pay your copays until out of your pocket and the insurance company's pocket. So let's say that you're taking Trulicity, and Trulicity is a $50 copay. I'm making numbers up. I'm just trying to make an illustration. $50 copay. So you're paying $50 for your Trulicity. The insurance company is paying $950 for their Trulicity, right? The government says, hey, listen, that means it's $1,000 drug. You pay 50, they pay 950. When the 2 of you together reach 5,000, it's actually 5,030, okay, in 2024. Right? When you guys reach that, you get out of the coverage gap and you are no longer paying copays, and the insurance company is no longer paying the balance. You move into the coverage gap or the donut hole, where you pay 25% of the drug cost. So if it's $1,000 drug, you're paying $250, right? And you pay that $250 from $5,030 up to $8,000. So you pay $250 increments. So $250 this month for a 30-day supply, $250 for the next month for a 30-day supply, until you bridge that gap between 5,000 to 8,000. Again, I just rounded the numbers. Once you get to 8,000, hopefully you will never get to 8,000, but once you get to 8,000, then the government picks it all up and it's zero. You don't pay a dime. In 2025, this goes away. Now, same deal. You pay 100. I know it's a dollar sign. 100%, if I can do it. There. 100% of whatever the deductible is for these 3 drugs. Still not these, right? So you're paying 250, 400, 475, 580, whatever it is your deductible, you're paying 100% of the cost till you get to that deductible. Once you've reached the deductible, now you're in the coverage phase, right? Where again, out of your pocket and the insurance company's pocket. But now look, only up to 2 grand. And after 2 grand, there's no more coverage gap. It's gone in 2025. You just go right to catastrophic where the government pays. That is a very, very nice thing. So if you, let's say that you have a $500 deductible, you drop in 500 bucks, then co-pays until you get to 2 grand, and then you're out. Done. They're paying for the rest of your drugs for the rest of the year. It's a very, very, very nice thing. Okay, so this is basically 101, just getting you up to date on the changes in Medicare and giving you a refresher what Medicare is. I will give you another video, right, on how to make an appointment with me because we have 4 weeks until October 1st, and I have about 2,000 people that I have to see. So first come, first serve. I will make that video on how to make the appointment and give you a link to be able to do so. Please do remember, I'll tell you in that video too, that once you make an appointment, you will get an email with something called an SOA, a scope of appointment. It is only a piece of paper that the government says I must have and keep for 10 years to prove that it was okay for me to talk to you about Medicare. I can't call and harass you. I can't, I guess I could send you mailers. I'm just not going to. So you have to fill out that appointment and then you're going to look at your email. It's already going to come filled out for you. All you have to do is click the little yellow button that says sign. Yes, I don't mind if this guy harasses me. Hit it again. It'll get emailed. I'll save it for 10 years and you're good. I hope that this was informative. I'm sure that I talk fast. I just didn't want to keep you on this video forever. If you have any questions, please contact me directly, and I look forward to seeing you guys soon. Bye.